Are you stressed out? I'm completely stressed out all the time with many jobs, lots of things happening. Is there something that's stressing out your body internally with oxidative stress? And is there something that could help that? Well, this video today, we're going to talk about glutathione. I'm speaking with Dr. Neil Paulvin, a well-respected Manhattan doctor who does hormone therapy, peptides, all sorts of different things. So we're going to talk about glutathione. My name is Joey Thurman. I'm a fitness and nutrition expert with over 16 years of experience in the business. I work with athletes, celebrities, C-suite executives, people that you see on movies, and I work with them to help build muscle, lose fat without working out 2 hours in the gym every single day. And we're just trying to get rid of some of the BS here. What is glutathione? How should you use it? How much of it should you take? And what can it help with, right? This and so much more in this video. You ready to learn about glutathione? All right, I am. Let's dive in. Dr. Paulvin, glutathione is this thing that seems to be magical that we hear about nowadays. What is glutathione?
Glutathione is, it's an antioxidant. Some people call it the quote unquote the antioxidant, the big guy. A lot of people are doing it either via IV or injection. Some people take pills. IVs are better. It's one of the things that you definitely want to do more IV if you can than anything else. What it does is it deals with oxidative stress, which means is damage that's done to your body from different toxins or even things that you get naturally. Stress can cause oxidative stress, which means that it's going to potentially damage your cells, cause inflammation, make your immune system hyperactive. So what you're doing is it's kind of taking a giant vacuum and getting that inflammation and all the damaged cells and chemical damaged cells, I guess in this case, and helping your body and get rid of them. You shouldn't be doing it all the time, but it's something that you definitely want to do on a pretty regular basis.
Okay, so the main benefit that people are using this for is to just help mitigate oxidative stress.
They're doing, yes. It's an antioxidant. That's what most antioxidants are for. Things like melatonin and other ones are out there too. So that's what you're trying to do in terms of dealing with oxidative stress, inflammation. Those are the main reasons you're doing it.
Okay, and then what are the benefits with taking this? I mean, people start noticing things right away. Like, is there a time frame of when you start taking it?
Not really a time frame that I've noticed. It really depends on. It's kind of the shame of it is that the worse you are, the sooner you're going to feel it, because it's like telling somebody you're $100,000 in debt. Oh wait, now you're only $5,000 in debt, so you're going to notice it more than if otherwise. But I mean, most people notice it if you're taking it orally. It's going to take probably a couple of weeks to really notice it. People who do injections or IVs, you could definitely notice it quicker, maybe within 1 or 2 sessions. Most people will tell you they have more energy, less inflammation, less joint pain, or they're going to have to say that they have more brain clarity, that they just feel mentally sharper, because some of them do go into the brain, and that's one of the reasons that people get what they call brain fog or kind of that forgetfulness, is because there's been some oxidative stress damage that the glutathione is working on.
Okay, is this crossing the blood-brain barrier then?
So if the IV can, the oral not as much.
Yeah.
I mean, some people will do other forms of it to do that. We just don't know for sure, but some do, some don't.
Okay. Now, is there like a recommended dose? Whether it's IV or orally that people are generally taking?
Yes and no, because some people have a problem in terms of breaking it down and using it correctly. So some people, when they use glutathione, will feel kind of actually the opposite. Will get the opposite results. Like we'll feel brain foggy, we'll feel tired, or may even get bloated and issues like that. So no matter what you're doing, if you're doing oral IV or injections, you want to start a low dose. Some people say between 100 and 300. But again, all these types of things you want to talk to your healthcare provider about, because they know what they're doing it for. And then all the doses will progressively increase over time. There's max doses on both the pills and the injections. But it really just depends on, you got to, with these type of things, you definitely want to go slow, because if your body doesn't absorb it or doesn't use it well, you're going to end up feeling worse.
Okay.
So it's usually a load, again, 1 to 300, and then I mean I've had patients on high as like 3,000. It, again, for patients with chronic illnesses, it works. Somebody who's healthy is not going that high.
Okay. And when you're saying 1 to 300, you're saying milligrams.
Oh, sorry, 1 to 3, yeah,
Okay,
milligrams.
yeah, just figured as much. But now, when people are taking these glutathione injections, you said you can do IV therapy. Are some people doing that on their own? If you're doing the glutathione injections, is this like a daily? Is this every few days?
We usually have patients do it 2 or 3 times a week if you're doing the self injections. The IV is usually recommended once to twice initially to get yourself up, and then many patients will do an IV maybe once or twice a month, or once, actually even once a month may suffice. Orally, obviously, you're taking it every day. If you are, again, I'm not sure if I mentioned it previously, if you are going to do it orally, you're going to do it you want the liposomal version versus anything else.
Okay. Is there anything that people need to avoid? When they're taking this, any interactions with any other medication or anything else?
Again, one thing would be if you make sure that your body can use it well. Um, the other thing that people should not use it with, is should not there's another supplement that makes glutathione called NAC, which has become very popular. So you don't want to use them together, because then you're going to overproduce glutathione and will feel worse.
Hmm.
If you're sensitive to sulfur, you want to potentially be careful as well.
Okay, cool. Now,
Or
is once you said some people, they take it and then they stop for a little bit. What happens if you're taking a high dose and then you stop?
you're not going to have any type of withdrawal type symptoms or anything.
Yeah.
You're just going to lose the side. You're not going to. You're just going to lose the benefits from it.
Okay.
I mean, if you're taking, only reason if you're somebody who's taking a really high dose that's prescribed by your doctor for something like a mold toxicity or some type of neurodegenerative brain issue, then you wanted to kind of potentially go a little slower, just because you may feel just worse for a couple of days.
Mhm.
But most people are taking a low to moderate dose if they're doing it at home, so it's not much of an issue.
Okay. As far as safety, where should people purchase glutathione, or is completely doctor prescribed?
The injections and the IVs obviously are doctor prescribed. Orally, I mean, there's a bunch of different brands that are pretty decent out there. I mean, I don't know if we're name dropping or not
Yeah,
in
no,
terms
like
of
if you
brand.
if you have a brand.
The ones I like are really, is either going to be Quicksilver. Dr. Shea's products are really probably the best in terms of oil that I've seen. I like Designs for Health is pretty good as well. Those are the two that I really recommend for glutathione.
Okay, yeah, because I'm often people when they're coming to this channel, they're like, "Oh, what do I take? What do I?" So it's nice to have some sort of recommendation on there, and I don't get paid by any of them, so it's fine too. No, there's if you like Google glutathione, a lot of things come up like, "Can I take quercetin with glutathione?" Is that something you've heard of before?
In terms of a concern, I've never heard that concern before. There should be the different mechanisms, so not to be an issue at all. And again, it comes down to genetics, but as long as you're not genetically unable to metabolize glutathione, it shouldn't be an issue.
Great, amazing, Dr. Paulvin. Where can people find you?
The simplest places to find me is the website, Dr. spelled out Paulvin.com, or on Instagram at Dr. Paulvin.
All right, man, I appreciate it. Now I'm gonna go, get my oxidative stress all knocked out. Good to go.